Hello, everybody, and welcome to another episode of the Caregivers Toolbox. My name is Ryan McAniff. I am your host, and on this podcast, we give education and information about senior care topics. We have a great guest with us, Bob Roth. He's got his hands in a lot of different things, but he's the managing partner of Cypress Home Care Solutions. But I'm sure we're going to talk a lot about other things other than just Cypress. But that's where you cut your teeth a little bit, it sounds like, and then really blossomed to many different things about senior care, excuse me. Bob, thank you so much for coming on and taking the time to talk to me and the listeners.
Ryan, thank you for the intro, and really, it's great to make your acquaintance. As we discussed before we got on the show, it's probably been close to 7 years, if not longer, since you and I got acquainted or met one another. But I do follow you on LinkedIn. I do follow your podcasts, and what a great honor and a privilege it is to be here with you today. And thank you for the invitation. And, I think many of us that are in this space have a personal story and a personal experience. And, I am a consumer product goods veteran. I worked for some really dynamite brands like Quaker Oats. I ran the Gatorade business on behalf of Quaker for 5 years in the Northeast. I worked for Dole Foods. I ran a frozen dessert company here. But really, how I got into home care was my mother, at the age of 48, in January of 1985, had a massive heart attack and found herself in the hospital for nearly 2 months, 18 days in a drug-induced coma, and came out a very different person. And my brothers, my dad, and I found ourselves as caregivers. Some may say accidental caregivers, but we were caregivers nonetheless. And it was really a labor of love. I loved what I did. And, I spent another 9 years working in the consumer product goods world, and I loved what I did, but really felt like we could make a difference in the lives of others. And my mom and dad moved to Phoenix, Arizona in 1987. We came out here for 7 years to vacation and be with them, and realized that this was a great place to live. And in 1994, actually on April 28th, which is our anniversary, is coming up this Sunday, will be 30 years. And Ryan, you and I got a chance to talk a little bit about your own home care business. We are the oldest out here in Phoenix that is family owned, family operated. We didn't get acquired by anybody, and we're still here. And that's quite a testament here in Arizona. And I know where you are in New England, you're at 55 years. So I have a great admiration and respect for your agency and being here as long as you have. And for us, we're going to talk about a lot of different things here today, but I think it's evolving and really being able to keep up with the changes that are happening in the marketplace. And those changes are happening at such a rapid rate right now. And it's scary, but it's exciting at the same time, the changes that are happening. I'll just add, just a little bit on my background. I spent 10 years on the National Association of Home Care and Hospice, their private duty Home Care Association Board of Directors. And then I spent 6 years on the Home Care Association of America's Board of Directors. I had the privilege of being appointed by Governor Doug Ducey here in our state of Arizona, and I was on the Governor's Advisory Council on Aging. And like you, I do a podcast radio show. I've been on for 11 years. It's hard to believe that I've been talking about the work that we do, and not only the work we do, but healthcare, for that long. So that's a little bit of background on me. And I want to thank you again for having the opportunity to be here today to talk to you about the work that we do.
No, thank you. That was great. And I think, when we were talking about how we got acquainted, and I had seen you speak at one of the conferences, I think people, and I think where we're connecting today again, is that you've taken the time. I imagine you're not getting Howard Stern style money for doing a radio show, and there's a much more passion project behind that of trying to give away information. And your story is similar to my story, in the sense of my mom got sick with cancer, and we found out, in April, and she had passed away by August. So very quick,
Mhm.
very quick decline. And what happens is people find themselves in those sudden situations of thinking everything's all right to moments later, not everything's all right. And we want to give back and say, hey, listen, we would try to drink from the fire hose and it's not a fun experience. So if we can give out information and try to support folks who inevitably are going to be in this position, because everybody gets older, everybody's going to pass away one day. That's kind of where I think I connected with you, because you can't fake trying to help people out, right? You know, you don't get
Wow.
paid lots of money to be on a board or be speaking at an event that you have to fly to. It's about trying to help the community, whether it's in your own industry or whether it's the community as a whole that are going to be finding themselves as a caregiver or needing care themselves. So, I
Yeah.
think that's why we do our podcast, because I can only speak for myself, but there's no money being made on the caregiver's toolbox, right?
No,
So, it's a
definitely
great thing.
not. And there's that old saying, and I don't recall who said it, but they say that if you do what you love, you never work a day in your life. And trust me, I'm a little bit older than you, Ryan, and I've got a lot of friends of mine that are retiring and they have built substantial net worths. And don't get me wrong, this has been an incredibly rewarding experience running a home care company for the last 20 years on behalf of my family. And I make decent money. I'm able to provide for my family, but that's not why I do what I do. I do it because at the end of the day, we're making a difference in the people's lives that we serve. I can go to bed at night knowing that we're providing a great service. And the best part about it, Ryan, and you probably experience this too, is that we get to be in that final chapter of someone's life. And sometimes it's all the way to the client or patient that we're caring for until they discharge to heaven. Sometimes it is to discharging to maybe a skilled facility or a memory care unit, but we get to be a part of that. And that to me, that's exhilarating. It's such a great honor. And it's not only the honor that we get to serve for that individual, but those families and making a difference. So, I applaud you what you do. The Caregiver Toolbox is a great resource. Health Futures, which is my radio show, is a great resource as well. Both of us put our stuff out there. And not only this show here today is about you, Ryan, it's about the guests that you bring and the topics that we talk about. And that's really, really exciting. And for me, talk about the evolution, whether it be 55 years in the business like you are, or 30 years like me, the period that we are now in right now, and that started the beginning of COVID to really 2050 will be a time like none other that this country or world has ever experienced, human mankind has experienced. And the World Economic Forum has described this era that we're in right now as the fourth industrial revolution. The changes that will be brought on about by this revolution will be faster, they'll be more volatile, and they'll be further reaching. They'll affect every single human being on this earth, and we will be faced with decisions to make that we never thought we would ever be faced with. And then the other thing is the democratization of the world is going to be really at all of our fingertips. I mean, we're all going to have these artificial intelligence um, aids, if you would, or assistants. I really believe that. I grew up in an era, and maybe you did as well. I used to be an athlete, so sports trivia was really big. And it used to blow me away how much people had right up here in their noggin. And they could give me ERAs for pitchers, batting averages. They could tell me all of these different things. Nowadays, we don't really need that. We just take our artificial intelligence pal that we have, and today it's a device. Tomorrow it may be reading glasses. The next day it may be an implantable thing in our brain, but we all have information at our fingertips. So it's an exciting time, but really a scary time too.
Yeah, it's going to be interesting to see what the future holds, and hopefully that's more exciting than it is scary. But with any type of change, especially something that's going to be as monumental as AI and machine learning, that is going to bring its own challenges, and there's definitely going to be some mistakes made, and hopefully they're not really bad. But it's definitely unprecedented. It feels like we'll see where this all goes, and hopefully we're able to navigate it correctly rather than it being it being a disaster, which is probably why that Oppenheimer movie has resonated with so many people, because that was kind of one of those times where this technology in the wrong hands could be the end of the world. And we saw on a very, unfortunately, nowadays, a minor scale, what a small nuclear weapon does versus now they have things that are far bigger that could wipe out whole cities or states in one bomb. Not to be too depressing, but I
No,
think that's one of those things where you sit there and you say, hey, listen, this could go one way or another. And I think that's why that movie did so well, because people are saying, oh, this happened kind of 50 years ago, and we'll see what the next 50 years looks like for the world in the United States with all this AI happening.
sure. And yeah, we could go down that rabbit hole and talk about those things. But at the same time, you used the movie Oppenheimer. Many of you guys that are listening here to the show, and Ryan, you may have heard it too, or maybe seen it, is the show Hamilton. And what a great production that was, and what a great history lesson that is. All wrapped up into, a 2 hour show, or 90 minutes, however long that is. I think it's 2 hours and maybe a little bit longer. But, I was told that if you didn't wrap Hamilton, it's like 9 hours of content, but it's wrapped in, and they're able to do it in a 2 hour show, a Broadway show. But there's a line in there by the Schuller sisters, and for those that saw it, and they use the line, and it says, look around, look at how lucky we are to be alive right now. And I look at it as not so much the doom and gloom. I look about how lucky we are to be alive right now. And we think about our ancestors. You think about your aunt who ran your business for many, many, many years. Look at what we can do now. I mean, we can do so many things in minutes that used to take us hours or days or weeks to do. And information is coming at us. Like I said, the democratization of the world is coming at us really fast. It's how do we discern that information to make decisions? That's really important. But there's so many things that I know you and I want to talk about. So I want to let you drive this boat. I don't want to, me, I host a show for 11 years, and I could probably steer our show down a certain path, but I want to be respectful to you, Ryan. You asked me to be your guest. Thank you for having me on.
No, I think this is great. And this is the whole idea that different guests go down rabbit holes, and we say we're going to talk about these things, and then these subjects pop up, and we get talking about them. And that's the beautiful thing about a podcast, is it can be anything you want it to be. So we can do whatever we want, but by all means, one of the things that we did talk about was, family caregivers. And one of the things that you had mentioned in our kind of pre-interview was that the press release that went out on the ARP grant that got taken down, and I think that's worthwhile mentioning. Could you give us some background on what happened there, and
Sure.
kind of where that's headed?
So we're a Medicaid provider, and we've been a provider of Medicaid services for all 30 years of our existence. We actually pivoted or evolved back in 2019 to just doing family caregivers. And there's a lot of reasons behind it. The biggest reason is the state of Arizona, like many states, are challenged with budgetary reasons. And, Medicaid is really stuck in this fee-for-service mentality. Medicare used to be there many, many years ago, but, Medicare has evolved more to a value-based scenario. And what do I mean by value-based? When people are listening to your show, is that, they're looking for providers like us, and obviously home health and hospitals, to provide value to the patients that they serve, and improve outcomes, and avoid unnecessary costs like an ER admission, or a rehab stint, or an event from happening which calls maybe more home health visits. So it's really important for us to really build value base. So Medicaid's stuck in this whole fee for service mentality, and agencies like mine couldn't supply care to just any Medicaid member of any of the managed care plans here in our state. And our state of Arizona is managed care oriented. We were the first state in the entire country that used managed care organizations to manage the Medicaid population base here in our state. So we do have a Medicaid office, and that's referred to as the Arizona Healthcare Cost Containment System. That's a large word, and it's access for short. We use a lot of acronyms as AHCCCS, but just the sheer name of cost containment in their name says exactly what they want to do. They want to try to control as much of the cost as possible for the members that are receiving care. So, like a lot of states, they received ARP is American Rescue Plan dollars. ARPA was, kind of the acronym that they used. They still had some of the money left. So I think that they're sensing that in the next administration that some of that money is going to get clawed back that wasn't used for COVID. But this state, like many others, there were others that did the same, said, you know what, we're going to use those dollars and put a grant out there to have people demonstrate value base in our world. So, we took that as a great opportunity. And because we were already in that silo that was just family caregivers, we did a partnership. And what I wanted to do for family caregivers, and just so our listeners know, there are about 54 million of those unsung heroes that are working every single day and not getting paid for the most part. Many of them are not getting paid to do this labor of love that I know that you did for your mom, I did for my mom and dad, to be able to care for them in a way that we will give them the best possible care possible. So, it's really hard for the Medicaid population group. The Medicaid population group, many of them are they're in socially economically depressed areas. They may not have a vehicle. They're having to give up their job. And because of the Medicaid waiver program in our state, family members can provide care and get paid for it. So the state of Arizona gives us that opportunity to employ sons, daughters, nieces, nephews, you name it, blood relative to care for their loved one and be paid by us. And it's our job to make sure they have all their certifications, direct care worker training, supervisory visits. So, we're kind of their lifeline. But at the same time, they don't necessarily have all the tools. So we did a partnership with a company called Navan, and Navan is an online training platform, which they have over thousands of training sessions that they're in as little bites as 10 or 15 minutes, or you can have an hour or two dissertation. But our goal was to take it in the smaller bites because these family caregivers are caring for their loved ones that are going through either fragility of life or through a diagnosis, and there are changes that do happen. So they may be equipped to care for their family member in the onset, but as the changing condition happens, whether it be that now they need high lifts and transfer, or they might be dementia, or there may be wound care, there may be a number of different things. They can take down a training module through Navan and have those skill sets basically overnight, get those tools to be able to care for that loved one. And then the other partnership we did was with Pocket RN. And Pocket RN is a partnership. This company was born out of the Stanford Medical Accelerator Program, Healthcare Accelerator Program. Jenna Morgenstern Gaines is the co-founder, and her partner Sam, who's a doctor, came up with this concept of having a telehealth solution. And basically, it's a nurse in your pocket. So to avoid a ER visit, if there's a change in condition, you can dial up a nurse, and that nurse can evaluate the situation. We're in this grant now for over 6 months, and we've avoided 5 escalations utilizing Pocket RN and Navan. And in 2 of those cases, we needed to have the member be seen. So we had Dispatch Health, which in our state, Dispatch Health is, and for our listeners, Dispatch Health is kind of like an urgy visit, that it's usually a nurse practitioner that
Mhm.
comes out to the home in an emergency case and can administer medications, can take care of wounds, run IVs. So in 2 cases, we had these guys come out and they remedied the situation, rather nicely, and we avoided an escalation. So So essentially what we're trying to do is trying to bring value base to keep people at home, give the family member that is caring for their loved one the tools in their tool belt to be able to care for them. So if they need additional training, they can get additional training through Navan. If they need a telehealth solution, they can get that through Pocket RN. And the coolest thing about Pocket RN is that because family members typically don't live in the same state, HCOA says it's about 280 miles is the distance between an adult child and a parent that they love and care for. Because they don't live in the same state and they're not able to accompany mom or dad in a visit to whether it be the ER, primary care, or specialists, you can have a nurse attend those sessions on your family's behalf and ask questions and help develop the care plan and listen to those orders. All you have to do is set it up with them and you're there. You can have a nurse for life. So the concept for me is to really bring value base to the family caregivers. 54 million of them are out there. Not all of them are on the Medicaid system, but there are agencies like yours and mine that can bolt these on, and we have bolted it on outside of the Medicaid population. So for all our private care, we are putting that out there for private care usage. And you can appreciate this, Ryan. I'm not looking to charge for it. I'll bear the cost. I just think it's a value added wraparound service to give to anybody and everybody out there. And Navan, we've adopted using Navan for all my caregivers. So all my private pay caregivers, they all go through Navan training. And the coolest thing about both, especially as we report to the state, is we can report utilization because we can report when they take down a training session and how many minutes or hours they've been on it. They do testing and how they did on testing. And we can report on when they had an escalation has happened and they've needed to contact Pocket RN. So, really bringing that kind of reporting to our grant and if it's not the grant to the family member or the referral partner on the private care side, I think is really huge. So I know that's a rather long-winded answer, but that's what we're doing. The grant we took down was nearly $500,000. We put out a second, or should I say, Access, our state's Medicaid, put out a second grant. This one was for as much as $1 million, and we'll probably find out in the next couple of weeks if we took that one down. And for us, it's to bring value based to this really vulnerable population, the Medicaid population.
Yeah, absolutely. I mean, and one of the things I was thinking about when you were explaining that too is as horrible as COVID was as an experience, and I'm sure nobody's going to say it was a net positive, right? But one of the unexpected benefits is that these types of services like Pocket RN have become much more well adopted because people were forced to accept Zooms and telemedicine and telehealth to be able to see a doctor or see a nurse. And so that, at least in my experience, that willingness to open up to technology kind of grew quite a bit because it was forced upon us because we didn't have another option and it wasn't a choice anymore. And certainly when we talk about as we've been at many of the association conferences, the big thing with caregivers is recruitment and retention. It's the same thing with nurses. It's the same thing with doctors. It's the same thing with PTs. I mean, every type of it feels like at least every single type of job that there is in direct care workers is lacking the amount of people versus the amount of care that is needed. And if you're able to have a nurse in your pocket that can see many different people in a day versus the traditional of having to go somewhere or having to do a home visit, that allows there to be a lot more productivity and a lot more people to have access to that type of care. And it sounds like that's where Pocket RN is really solving a problem for people.
Well, I'm so glad you brought this up because I've had the opportunity to have a lot of physicians on my show during COVID and after COVID. And just so everyone knows, the utilization of telehealth in pre-pandemic era was less than 30% by practicing physicians. It was in the low 20s. In the post-pandemic era, it's in the 70s. And it makes so much sense. I mean, first of all, thank you for to the Centers of Medicare and Medicaid Services, because they used to pay at a discounted rate for physician practices, and they pushed away from that because at the end of the day, if you know any physicians like I do, have been practicing for over 20 years, the reimbursement rates that they are being paid, kind of like what we are being paid on Medicaid, is shrunken so much. So, they weren't really adopting it, but during COVID, they paid 100%. And as far as I know, I think as of January 1st, it's still 100%. And they're encouraging people to do this. And for you and me, it makes so much sense because if you're caring for a centurion or you're caring for a 90 or 80-year-old that is very fragile, going to the doctor's office is the biggest thing that person's going to do that day. Getting dressed, driving, and ambulating to get to the doctor's practice, to sit in the waiting room and then to sit in a waiting into an exam room and get maybe 7 minutes from a doctor is really, really hard. And for us, because we are caring for very, very medically fragile people, in a lot of cases, they are taking, blood thinners, they're taking other medications, and they need to be seen on a quarterly basis to check their liver enzymes or whatever enzymes they're checking. All that can be done now through mobile labs. They can come and draw the lab or the necessary blood that they need or urine sample that they need. They can do that in your home. And you can schedule a telehealth visit and not have to have all the minutia that goes into getting set up and traveling over there. And it's exhausting. And you avoid all those germs that could be in that exam room or it could be in that waiting room. So you really isolated that person. So I think if anything good came out of COVID was really the adoption of a lot of tech, and telehealth is a big piece of that.
Yeah, absolutely. And that was the other thing I was thinking when you were talking about that was, for those that maybe haven't gone through this, when you go to the hospital with a senior, that is not a pleasant experience, unfortunately. If you aren't having a massive issue or a heart attack or something that is completely life-threatening, you could be there for 6, 7, 8 hours waiting to get seen. If you get seen at all and you're around sick people, you're exhausted, you're dehydrated at the end of the day, and then somebody comes home, and what is all that encapsulate? It means that they're weaker, they're tired, and they're an even bigger fall risk than when they went to the hospital themselves. And that takes a lot of out of a person, and it could cause there to be another visit to the ER because of a fall, and it starts perpetuating itself, and you're in this kind of doom loop of how do you get out of that? And so avoiding that ER, as much as hospitals and doctors and the people that work there are great people, it's not the most pleasant experience for somebody that's younger, let alone somebody that's an older adult. And if you're able to, like you said, have blood work done at home or have these services be remote and or come to you, that's a huge benefit that um, would be a good thing. And also it opens up the hospitals to do what they do best, which is treating, acute issues that need immediate attention, not chronic diseases that aren't killing you in the next 24 hours, right? So there's definitely some benefits there to avoiding the hospital and using it for what it is rather than it being a catch-all for everything and everyone, and then it becomes clogged down and bogged down, and it becomes a really rough experience for individuals. So I only really just 2 days ago I bought a blood work that I'm going to go to Quest Labs and get my bloods drawn and see how my heart is doing and things like that. I'm in and out of there in 15 minutes, and how great is that versus having to wait for an actual doctor? And that's more of a I guess that's another rabbit hole we could go down, but like getting
Mm.
a doctor's visit is next to impossible these days.
Oh, it is.
And if you see a doctor, you're lucky because you're likely seeing an NP, which I'm not saying is a bad thing, but that's not a doctor. And so I'm like, it's just easier to pay out of pocket and go to the lab, get my blood drawn, and then if there's an issue, I can email it over to my doctor and we can have a discussion about that. Like all of a sudden it becomes much more economical time-wise than even the money side of things. But
You
the
know,
points you're making are very, very valid.
I do want to add one thing, and having physicians on my show, one of the things that they did share with me is that they get to have more intentional visits. The visits are longer, and they get to see their patient in their home. And I had this one doctor tell me about this one patient that took him on a tour of the entire home. He met the dog, he met the cat, you got to see the backyard. I mean, you get to see as a physician where your patient is living. And you and I both know this, Ryan. There's a lot of reasons for people to be unwell. And a lot of times it's because of the home. And you can see in that home, if it's cluttered, if it's a mess, you might see stairway, so all these types of things could contribute to some of the health challenges that they're dealing with. So it is really nice. I mean, that they get to see their patient where they live and where they're at. And the patient really loves to show them. Let me show you my house. Let me
Yeah.
introduce you to my son. Let me introduce you to my dog. It's really they get more intentional, and it gets to be more of a personal visit.
And it touches on senior isolation as well, right? And all of a sudden it's certainly the visit is medical, but it also somewhat feels like a friendly visit that, you talked about. It's the big thing of the day is going to see the doctor. Well, now the big thing of the day is I get to see my doctor and show him around and show him my life and be able to talk a little bit more about me rather than just what's bothering my knee or whatever the issue might be.
So my dad, God rest his soul, I lost him about a year and a half ago. He had 12 doctors that he would see almost routinely. And they all ended in gist, right? Urologist, cardiologist, nephrologist. I mean, it's crazy how many doctors our older adults are seeing. And that's part of aging, right? But it is really hard. And he used to go to visit each one of them, whether it be once a quarter or once every 6 months, some more frequently if he was having certain issues. So I think the best thing that happened out of COVID is the adoption of telehealth and being able to do that. And for us in home care, we're now able to bring, and that's what I really love on the private pay side, is I can bring a whole clinical element that I can't bring as a home care agency because I am a non-medical home care agency. And by the way, I don't like the word non-medical. You may have heard me say this, Ryan. We're in-home supportive care services. That's what we do, in-home supportive care services. We're not home health. We are home care, but we get confused with home health when we describe ourselves as home home care. We people think and mistaken us as being home health, but being able to have that kind of partnership and really having that demarcation between clinical and non-medical is that we have a clinical partner in Pocket RN or in any telehealth solution that you go in with that can really discern when there's a change of condition. And one of the hardest things that you and I have, and this is at no disrespect to our home healthcare partners out there, but they're all having problems. We're having problems, and we can talk a little bit more about caregivers, but they're having problems with finding nurses, speech therapists, occupational therapists, physical therapists, CNAs. They're struggling with that. And for us to be able to call a home healthcare company to intercede could take days where we can have Johnny on the spot right there in a telehealth solution to be able to discern a change, maybe make a prescription order and have that delivered to them, or have a situation, like I said, with dispatch health and elevated, don't have them go to the ER, but have someone come in to them. So I'll step back, but we could talk
No,
about
no.
this for a long time, but I really love where we're going. And being a 30-year-old home care agency, this has all really been new over the last 4 or 5 years, and it's exciting. It's an exciting time right now.
Well, and we didn't talk about this before, and if you want to punt this and not get down this rabbit hole, but it is pretty new. 80/20 rule just came out. Is that something you have thoughts on, or do you want to think about that before you make a public statement?
No, you know what? I do have some thoughts on it. I think first of all, we were told it was going to be 4 years to implementation. Now I believe it's
Well,
six.
before we jump into it, we should probably just explain what the 80-20 rule is, just so people that are first hearing it may get a little bit of a background on what that is.
Yeah, so the 80-20 rule is basically it's a mandation that comes down from the US government, primarily CMS, the Centers of Medicare and Medicaid Services, and they are mandating that home care agencies or any supplier of care services, 80% of which you get reimbursed has to be in of the form of a payment to the care worker, the direct care worker. So it gives us the ability to hold back 20%. Um, there's a lot that goes into employing caregivers. They are allowing us to count taxes and workers' comp, but there's a lot of other things that go into it, insurances and stuff like that. And, many people, and as I described at the beginning of the show, I mean, we're only doing family caregivers because the fee for service is just so low. And we did not get an adjustment for cost of living this year. And we did not get a minimum wage increase that we really needed. We got a little one, but nothing like what we needed. And part of that is because our state is in a deficit. Our state has over a $1.5 billion deficit. So basically, we couldn't show up on the budget. And, we don't have the funding to adequately employ caregivers. So that's why I chose the family caregiving route. So this is kind of earth shattering for us. We had almost a year. It may have been a little bit more of a year, more than a year, when the announcement first came out to be able to give our responses. And we were very, as part of Home Care Association of America and the National Association of Home Care and Hospice and the Partnership for Medicaid, we really did a lot of writing to our Congress people, to the people at CMS saying that this is not fair. We were really thinking that we were going to come in at 70-30 or 75-25. We knew that we weren't going to get them off the whole concept of dictating how much money goes to the caregiver. But I got to tell you, I feel like this is un-American. It goes against free enterprise and the idea of really being able to have a business and make money being dictated to told how much we need to pay the caregivers. So that is the ruling just came out. We were initially told it was 4 years to implementation. I believe what I read last night was 6. So a lot can happen between now and then. But there are a lot of my brothers and sisters out there that own home care agencies that are primarily Medicaid companies, and they're reliant on, being able to make a decent margin. But by dictating this, I really believe that there are going to be a lot of companies going out of business. A lot of companies have already talked about geos, and when I talk about geos, geographies where they're in, that they know they're not going to be able to make it work. So when this does come down, they're going to be pulling out of the market. So at the end of the day, the biggest loser is the member. And we're having a hard time in our state right now. We have this association. It's called the Elderly and Physically Disabled Provider Alliance. That's EPDPA. That's a mouthful to say. We're big with acronyms. We discern that we represent probably close to 20,000 members in our state. We discern that nearly half of them may not be getting services because we can't find caregivers to work for the wages that we have to be able to pay, and we have to make enough of a margin to make it work. So these are going to be desperate times for this population group. So it'll be interesting to watch. There's going to be a lot of lawsuits, I believe, coming out. And NAC will probably be on the top of that, and the Partnership for Medicaid will be there, and I'm sure HCOA will be there. So we're going to do what we can to get our voice being heard. But at the end of the day, it shouldn't be shameful to make a little bit of money, but we should not have our government dictating to us that this is how much money you can make, because the big guys will make a lot of money. I mean, the big guys like Addis and Help at Home, they're really big companies, and they're employing tens of thousands of workers. They may be able to make it work, but the little guy like me or you, it's going to be really hard. So these are somewhat tumultuous times, and it'll be interesting to see where this thing goes. But this is very fluid. I'm glad you brought it up. I was reading up on some of the stuff this morning, but we are coalescing together. We were coalescing together before, and it's nice when you can have trade organizations all working together because we all are impacted by this decision, and we were working together before, but we're going to work together even closer now to see where we can get this, see what we can do about this so that this can be a sustainable business. But they got to start paying. They got to start paying us decent rates. And, in Washington State, they're getting the equivalent of about $40 an hour for the work that they do. In our state, we're getting less than 24. So
Yeah,
it's hard to make.
it's really wild how it's different state to state, and that's probably one of the things that my knowledge on CMS and Medicaid is pretty limited because I'm not in that world. And so but from what I know with my contacts in Massachusetts, it's that, and you talked about it with deficits, is the deficit isn't just on the state level, it's of course on the federal level as well, that there's just that the Medicaid and Medicare and CMS come up with a huge chunk of the budget, and this seems like a way to try to I guess I'll say support the caregivers in their way of doing that, of getting them, trying to get them more money, but without adding to the budget itself and the deficit. And if you look at the benchmarking survey that comes out every single year for private home care, you're dealing with margins of around 45%, right? That's what kind of is the ballpark, plus or minus, of gross profit after you're paying for your cost of goods sold. So using the example of $1 million revenue agency, if 80% of that is going to your caregivers in Massachusetts, you need to have an RN on staff to oversee your operations. And the average RN in Massachusetts is paid $100,000 a year. So now you're at 900,000, and then there's 100,000 left over for the rent, the utilities, the other admin staff, profit, salaries, things like that. It very quickly seems like there's not a whole lot of meat left on that bone to be able to run an appropriate agency. And that's going to lead to, like you said, people exiting the industry, or it's going to lead to people bare bone services that are going to trickle down to the quality of care that people get. So it's going to be interesting to see, kind of like how we started this out. The next 5-10 years is going to be really interesting, but this came down just 24 hours ago, and it was interesting to see on LinkedIn that people who usually don't have a hardline opinion one way or another on things and try to keep it copacetic were very much not in favor of this because of the concerns they have for the quality of the care, their business or their employer, or all the things that this can impact. So it's going to be interesting to see what the next 6 years bring, and where
It will be, and at the end of the day, it is about quality, but to me, it's also about access to care, and I think if you have more home care agencies that are providing home and community-based service work for this population base, pulling out of certain geos or closing, the access to care is going to be dwindling. So, it's really important for us to coalesce together. We're going to work together in developing appropriate responses, talking points, and messaging. We're going to continue to connect with like-minded groups that are not even just in our vertical, but other stakeholders, whether it be the Alzheimer's Association, Parkinson's Foundation, any, AARP. We need everyone to coalesce around us on this. And the scary part of it is, and I don't want to come across as this union busting guy, but it just smells very unionish. It really does. It smells a lot like the SEIU. So, we'll see where this thing goes. I was very pleasantly surprised to see 6 years, and a lot can happen in 6 years, but we have to come together now. And I think we're doing that right now. I think if anything that happened through COVID, again, a positive, is that we've really learned how to really coalesce and work together. So we got a lot of work ahead of us.
Well, that kind of, and I appreciate you off the cuff talking about that. It was just so timely. Um, one of the things we kind of talked about via email about like what do we discuss, and like we guessed, what time wasn't going to be much of an issue with two guys that have their own podcasts and radio shows. We can talk. But where do you see home care going? And maybe that dovetails with your work with Sensi AI. But like, the next, the last 10 years, you talked about how in between where I took over Minute Women to where Minute Women is now, it's two totally different companies, utilizing technology in different ways, trying to provide services in different ways, and the focus is different in being, a general home care company versus specialized home care company. Where are you seeing the next 10 years? When we're in 2035 or beyond, where do you see home care going,
Wow.
and where that happens?
Well, I want to give some data so that our listeners really know this. So the 65-year-old population between now and 2050, we can talk 2035, but 2050,
Sure, we can talk
which is which
2050.
is 26 years from now. And look, it'll be here before you know it. But the
Goes by quickly.
65-year-old population is going to double. It's going to double. And the 85-year-old population is going to nearly quadruple. So I want our listeners to chew on that. I mean, we're talking 85-year-old population nearly quadrupling. It's going to go from like 8 million people to like 22 or 24 million people. And our 65-year-old population is going to go, I forget the numbers. I think it's 42 to like 88 million. So we're going to have a lot of people in our country that are going to be old and they're going to have needs. The other point that I do want to point out is that, and here's a personal question. I'm just getting to know you. I'm assuming, but maybe I'm wrong to assume this, that you have children, you're married.
I have a long time girlfriend. She has kids, but I don't have kids of my own.
All right. So how many kids does she have?
She has two adult children.
Okay. So she's close. And what do I mean by close? That in order for us to keep our population where we're at right now, and I'm talking about the US population, that every childbearing female in our country needs to have 2.1 children. 2.1. And right now we're at 1.7, trending down to 1.6. So, I give you the facts about how quickly we're aging. And I also give you the facts that we're not having enough children as a country. We can have a whole conversation about the 10 million people that came across on the border, and one of them being in Arizona, and certainly across the border in Texas and California and other borders that we've had issues with. But I purely want to talk about that. So if we're declining in birth rates and we're growing exponentially in terms of need because the 65-year-old population is doubling, the 85-year-old is going to nearly quadruple. How do we care for these people? There are not enough humans. But one of the things that we know is that we need humans. We talked about it earlier. 1/3 of our population, 65 and older, lives home alone. Oh, and another startling fact, Dr. Joseph Kaufman from the MIT Age Lab says by 2050, that number is going to encroach to 50%. So we're going to have 50% of people 65 or older living home alone. So robots, not going to see it in my lifetime. Ryan, you may see it in yours, but our children, maybe. And even if we had robots, they're so expensive. And they got to be able to lift, right? And humans can do that. But humans need humans. And there's an old saying that is technology makes things possible, but humans make things happen. So I really believe that we need to have wraparound services. We need to be able to augment the care that we're doing utilizing innovation and technology. And I think that's an imperative that we have to adopt. And, I know that there are lots of companies out there. And, I know there's a company that you're part of called Well Aware Care. And you mentioned Sensi, and I've talked about Pocket RN, and, certainly using Navan. These are all innovative tools to be able to help care for someone. They're important. They're not going to replace humans, but they're going to be able to discern when there's a change in condition. You're well aware care uses radar, and you're looking for changes in gaits, you're looking at change in motion. These reports that you can get from devices like that, or devices like Sensi, devices like Help Any that I just described to you before, they will be able to tell you and predict. And that's the important thing, is to predict a event from happening. Prevention is the key. Is we want to prevent an event from happening, and it's important for us to be there for the activities of daily living, ADLs. And those ADLs can be from helping getting dressed, to helping with a bath or a shower, to providing meals, to reminding medications, all the stuff that men and women do and what we do at Cypress every single day. But if we can be there during the day parts, and hopefully during the awake hours, where these activities of daily living are needed, but provide the wraparound service during the wake hours, but also during the non-awake hours or the non-care hours are really important. The other piece is that we really need to start thinking about, what do we do with this population? And how do we care for them? I mean, you know, Arizona is a very sprawling market. Maricopa County, which is considered the largest suburb in the entire country, it was indicated in 2016 and 2020 presidential election. It was given that title. I mean, we have 4.6 million people that live in Maricopa County. It's 9,228 square miles and 68 miles from one end to the next. It is a huge, huge county. But I really believe that we need to start thinking about, how do we bring more of the older adults more into the city and more into a condensed area. I really believe that the village concept, which really started right in your backyard, Beacon Hill was the first village concept that was kicked off over 20 years ago. And there's over 200 of them now, and there are 200 that are in development right now, is really going to be critical and key. And through that, I really believe we'll be able to do more sharing the care with multiple people, and think about Golden Girls, think about those types of situations. I also think that intergenerational living is going to be a big part. I really believe that families are going to be living together more than they ever have in the past. Um, I wouldn't say more than they ever have in the past, but the last century, the century my grandmother grew up in, and my mother did, the nuclear family was there in the neighborhood, sometimes in the house. And we're seeing that right now with a lot of different cultures. So for me, I'm in Arizona. We have a huge Hispanic population. In my 20 years at the helm, I can't speak for the 10 years prior. My brother Joe ran the business 10 years prior. I can't count on one hand how many Hispanic clients I've had. I've had hundreds, if not thousands, of Hispanic caregivers. And the reason why is because they take care of their own. The family lives together. So I really see that movement happening more. Look what else has happened during COVID. People are working from home. People are able to not commute. And, companies are giving people the latitude to be able to, work from home. You can have a child and be home with your child, and intermittently be able to care for them and be able to be working. You can do the same with older adults. We've been trying through HCOA for a long time to be able to get the HSA rules, the health saving account rules, changed. And while we have not been successful yet, I really believe that success is going to be and should be near to us soon. And that is, we should be able to use HSA dollars to care for older adults, not just children alone. So, we need to be able to access dollars to be able to provide care. And whether it be providing caregivers, or whether it be, purchasing medical equipment, or, having a shower redone. I mean, we should be able to access those HSA dollars. So for those listeners that are listening in to your podcast, we need to advocate, and we need to really be out there in front of our local Congress people and senators, and being able to get that accomplished. So Where do I see it going? I see wraparound services like what we have and what you have. I see more intergenerational living. I see more intentional living, intentional communities like villages. I think that's the only way we get through this. But the startling facts are the fact that we're doubling 65-year-olds between now and 2050. We're nearly quadrupling 85-year-olds. The need is through the roof, and we don't have enough people behind us. We need more people. I mean, my daughter is a labor and delivery nurse. It's Cedars-Sinai in LA. She's been working there for over 5 years. Last month, a 59-year-old gave birth to a child. She doesn't see that many people in their 20s. It's usually 30s and 40s. I mean, people are waiting longer to have children and they're not having enough. So there are the facts. I see that as really the problem solve is, again, wraparound services, intergenerational living, and really being able to create these intentional communities where you can share the care.
Yeah, I mean, a lot of those things make sense, and a lot of those things are likely to happen, not because they're necessarily great ideas, but because people are, people in their 20s and 30s are very concerned they're never going to be able to buy a house, right? And if they're feeling like, hey, that's unattainable, then maybe they're going to be at home. There's certainly a number of different things that could be the catalyst of why somebody's doing that, but it ends up being that there's an intergenerational home, right? So if somebody's feeling like, hey, listen, I'm never going to, in the Boston area, many of the towns inside of 95, you're not even at the table to bid on a house if you're not talking 750 to $1 million minimum to buy a home. So for a lot of people, that is an unattainable number. And I don't mean to go down that tangent, but there could be a lot of reasons why that happens. And I think at the end of the day, I see that as well, that, a lot of people are living together that have multiple generations in one home. And that certainly allows families to be able to provide the care. Debbie, as I mentioned, my girlfriend, and she works with me. She's on the website. Her mom lives with two other women that are older as well. So they have that Golden Girls going on in a 55 older community, so that they're able to help each other when one quote unquote falls. And I don't mean that literally, but one's having a health issue, then making sure they're taking their medications, they're okay every single day. And if there is a escalating problem, then they can bring in help through family or through emergency services because of that. So we're already seeing those things playing out, in Massachusetts itself.
Yeah, we need to cure the social isolation issue. It was long a problem before COVID, and it really got spotlighted during COVID, and certainly those people that passed, what tragic, it was so tragic that the family members didn't get a chance to say goodbye, and they had to speak through windows, and that just really, like I said, shone a spotlight on that, and really spoke volumes for why care in the home makes more sense. And we talk about these wraparound services. We talk about diagnostic testing that can be done at home. We talked about Dispatch Health and other visiting physicians that come to visit people in their home. I do like the clustering. I like the idea of Golden Girls. There was a company that I met about 7, 8 years ago called Silver Nest. Wendy Burkhart was the founder of that. That was, kind of a concept that we could bring older adults together, or older adults with young person where they're renting them out a room, and they're there to help them through the fragility of aging. So I think, everything's on the table. It's really nice to see where we're at. I'll go back to the quote from the Schuler sisters, look around, look around. What a great time it is to be alive right now. I mean, the coolest thing about the work that we do is we get to make not only people's lives better, but we get to be part of that change. I mean, how exciting is that? I mean, Ryan, your podcast, my radio show and podcast, our individual agencies. I mean, we're on the forefront of really changing and reshaping the way care is going to be delivered. I'll leave you with this. I mean, home care, in-home supportive care services, which I like to call it, it's only been around since like 1990. In 1985, when my mother had their heart attack, there were no home care agencies. There wasn't a home instead. There wasn't a visiting angels. There were home health care companies, but not home care companies. I give it to, Paul Hogan and Lori Hogan, who started Home Instead. Started the same year we started in 94. But what they did was they added some credibility to the space. And, now there are like 100 franchises out there. And like I said, there are over 700 here in my marketplace. There's enough business for all of us. And I'm not here to compete against any one of them. All of them are my friends. The biggest competition we have in the space we're in, and certainly our listeners should be weary of this, is these private caregivers. These private caregivers don't have the background, don't have the oversight, don't have the training, don't have the insurances that you would need to protect that vulnerable adult. The biggest insurance piece, and people do this every day, and you and I talked about this before the show, we used to be supplemented, our care used to be supplemented by private care. And now more and more people are using private caregivers and they're supplementing it with us when that private caregiver can't work on weekends or goes on vacation. But I want the listeners to know the biggest piece, and yes, you might trust that caregiver. They may have come referred to you and they're not going to steal from you, but there's just something about skin, water, soap, and bathrooms that is a recipe for disaster. And I'm here to tell you that if a caregiver, a private caregiver, gets injured in the home, which an employed caregiver, it's happened to in my business, and I'm sure it's happened in yours, where a caregiver injures a shoulder, a back, a knee, guess what? That's on that person that is employing that private caregiver. Your homeowner's insurance ain't going to pay for it. That $3 or $5 million umbrella insurance, you think that's going to pay for it? No, not going to pay for it. So it's really smart for people that are looking to engage services to use an employer-based agency that has workers' comp, so that that back that goes out that costs $90,000 and hospital stay and surgeries and stuff like that, you don't get stuck with, because I guarantee you the adjuster that comes out from that insurance company ain't going to write you a check, because when they find out that Gloria, who is helping you be able to maintain your existence as a paid caregiver, they're going to deny your claim.
It's a huge risk. It's without a doubt the biggest risk outside of some of the other ones that we've seen in the news and the problems that,
Exploitation, financial exploitation, all those other things can happen. But I mean, no one ever thinks about the workers' comp piece.
no, and so I mean that is kind of, and I mentioned that's why I think live-in caregiving is going to go kind of continue to decline, because it's too easy to just pay privately for that, and we'll see what happens, but it's going to certainly be an interesting next couple of years, without a doubt. Bob, thank you so much for coming on the podcast. You gave me so much of your time. I really appreciate it. I don't think going down any of the rabbit holes or anything you talked about was not going to be valuable to the listeners that are listening to this. So I think that we had a really great conversation. I appreciate it so much.
We did.
Anything else you want to leave off with, or are we good to go?
No, I think we're good to go. Listen, I love the work we do, and Ryan, it's really great to get reacquainted with you, and I love what you're doing. I mean, look, we need more people out there really espousing to this type of work that we are in. It boggles my mind. We're 30 years, you're 55 years. People still don't realize there's such a thing called home care. And I really, really applaud all the franchises that are running their ads, whether it be Visiting Angels, Home Instead, Right at Home, and they're helping all of us legitimize the work we are doing. The biggest challenge we have is that the pay that we receive comes from 4 payer sources. It's usually private funds or family funds, long-term care insurance, VA benefits, or Medicaid. And you and I disappoint nearly 50% of the people that call us every single day. because they think Medicare pays for this. They think that Medicare Advantage or Medicare Supplement, and the answer is no, no, no. And they're disappointed, and they tell us, oh, the doctor said it would pay. I'm sorry. Medicare Advantage, yes, they did put a provision in there in 2018 where they are offering in-home supportive care service work. About 20 to 30% of the Medicare Advantage plans have it, but they come with such limitations: 40 hours per member a year, 100 hours per member per year. The rates are commensurate with Medicaid rates. So there really aren't the resources out there. And if there's any appeal that I want to make to your listeners, and whether you're in this business or not, you need to do long-term care planning now. Now's the time. Because if you don't plan for this, you are going to be really in a bind, because the weight of the world is going to be left on your family. And if you want to give a gift to your family, whether it be buying long-term care insurance, whether it be saving for this rainy day, need to start thinking about that now. I know that some might say I'm a little hyperbolic. I wrote a column on this. Oh, by the way, I write a column. I've been doing it for 16 years. I wrote a column on long-term care services at the beginning of the year, and I said that you need to start saving it at the time you graduate high school. But really, you need to start thinking about that. And I think that's the biggest challenge that you and I have as agency owners, is that our families and individuals just aren't prepared for this. And they try to figure out how to get care, and they make sacrifices, whether it be for pharmacy drugs that they need, whether it be food. It's really sad. So we have a real problem here, and we need to help elevate that. And it's platforms like yours or mine that hopefully we can get to listeners and help them be better prepared. You know, that old adage about being forewarned is to be forearmed. So let me tell you something. It costs a lot of money. 24/7 care, whether it be in New England or in Arizona, is going to cost you between $350,000 to $400,000 with after-tax dollars. You can do the math. If it's 12 hours, it's half of that. If it's 6 hours, then it's half of that. But it's a lot of freaking money. And where is that money going to come from? Need to start thinking about that now. Thank you.
I think that's absolutely a fantastic point to be made, and a great way for people to think about and get ready to get planned. The only thing I'll add to that, and actually it's kind of funny because usually when I do like a public speaking event, I say, you don't have to use my services. I'm not expecting anything. The only thing I ask for you is either go to 5 Wishes, or in Massachusetts, it's Honoring Choices. Get some planning done, start the process, have the conversation. And it is a gift not for yourself, but it's for your family members, right? This is a gift you're giving to the next generation to make this as easy as a process as it possibly can be.
And you're actually, I was talking about long-term care services, but you're talking about something that is really important. And you and I speak about this too, and that is advanced directives. And it was National Healthcare Decision Day last Tuesday, the 16th. And, it's an awareness, it's a conversation you need to have. And to your point, you're going to give a gift to your family members by telling them what your wishes are. Because if you don't do that, it is going to be completely tragic not having that. So it'll save your family the anguish. It will save health plans, state and federal government, a lot of money. We know that 50% of the Medicare dollars used yearly are used by less than 10% of the Medicare population in their last year of life. And you know what? Many of them didn't have advanced directives, so they're utilizing artificial means to keep them alive. So really great point, and I really appreciate you bringing that up. And that's something we need to really drive home.
No, thank you so much. And thank you. If you want to learn more about Bob Roth, Cypress Home Care, it sounds like he's got so many jobs. I can't list them all, but you're going to be able to Google him and find him. Bob, thank you again for being on the podcast so very much.
Yes, thank you. And you can always link into me. That's always a great place. If you're a home care agency, you can really get a lot of information, whether it be from Ryan or me. LinkedIn is really my preferred social media outlet for business.
And he does respond. That's how we got connected to do this podcast. So he's speaking the truth. He's on there. So, yes. And to our listeners, thank you so much for listening in, and we will catch you on the next one.